This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, from Philadelphia to Erie, from Scranton to Pittsburgh, it's Behind the Headlines. I'm Charlie Greenewald, Senior Fellow of the Susquehanna Valley Center for Public Policy, and I'm joined by my friend and fellow Susquehanna board member, Jerry Strickmatter, a former member of the State House of Representatives. Jerry, it's nice of you to fill in for Maura today. Maura's out on assignment.
Happy to do that.
Well, we're
looking forward to learning a lot today.
Happy to have you here. And what is, of course, one of the continuing major issues in Pennsylvania and Pennsylvania state government is health care and hospitals. And we have a great guest to talk to us about this today. We have Mr. Jeff Bechtel. Jeff, welcome to the show.
I'm happy to be here. Happy to be here.
You are, Jeff, you are the Senior Vice President of Health Economics and Policy for the Hospital and Healthsystem Association.
Yes, long title, but that's correct.
How long have you been in that position?
3 months, so I'm very, very new to this position.
Okay. Well, there's an issue that has reared its head in Pennsylvania and other states that we'd like to see if you can help us with, and that is the whole issue of something called balance billing.
Yes.
I believe that there's lots of people in my family who've struggled with this issue.
Right.
Exactly. Could you tell our viewers what balance billing is?
Yeah, it's a great question to kind of kick this off. Balance billing, and it's kind of a lot of permutations, so it's not a simple issue, but probably the best way to describe it is a situation where a hospital is in network with an insurance company. But a hospital-based physician, and two common physician groups are anesthesiologists or radiologists, may not be in-network. And just generally, what in-network means, if you're in-network, that means you've already negotiated rates, for example, and it's a very complex contract with an insurance company, but you're out-of-network, you have not established those rates. So if you go to a hospital, for example, for a procedure, and for whatever reason you're seen by a physician that is not a hospital-based physician that is not in network, there may be a situation where the provider, the physician, would bill an insurance company to seek payment, but because they're out of network, they would not receive all of their charges, for example. And then what would happen is that physician would bill the consumer for the balance, and that's you've heard the term balance billing, and they're referring to the balance between what the insurance company paid and what the physician is charging. And when that happens to a patient, and they're not expecting this, that's the term surprise billing. So that's commonly the situation, and we can get into, obviously there'll be questions about why this happens and how we can avoid it and what we can do about it, but that's the best explanation I can give. Does that make sense?
Yeah, thanks a lot for clearing that up, because when you first hear that term, it could mean a lot of different things.
Right.
But I understand what we're talking about today, so our viewers understand that. And certainly the other thing that makes it more complicated is, even though we're talking about today, unless they're sick and unless they enter the system for some reason, they're not going to be paying a lot of attention to it.
Absolutely.
It's only afterwards. So it was just like with the telephone industry, telephony. Deregulation hit over a period of maybe 20 years, depending upon when they wanted to change. Same thing here. This really only impacts our viewers when you get sick or a loved one gets sick.
That's
and
correct.
then you have these large bills that come in.
Potentially, in these circumstances.
So
yes.
I'm really glad that that you're here to try to clear that up. What do you think the answer should be? From the major provider of healthcare to all the viewers. What do you think should happen?
Well, I think this is one of those complicated issues that involves, I think, a lot of different solutions. I mean, consumers obviously have a responsibility to make sure that they do their homework so they understand to the extent they can whether providers that they plan to see are in or out of network. But that's not always possible, and we can talk about why. There's certainly a role for hospitals, first of all, to provide information to consumers. And one of the things the hospital community has done has prepared something called, and I'll read it here because it's very complex, it's called the Principles for Operational Guidelines for Consumer-Focused Hospital Financial Services. And essentially, it's a document, a stake in the ground, where about 70% of Pennsylvania's hospitals have adopted these principles. And the principles essentially are designed to ensure that hospitals provide as much information about the financial interactions that they have when they enter the hospital. And one of the principles talks about this very situation. And the hospitals that have adopted these guidelines have committed when an individual enters their hospital to provide as much information about what the costs will be, the possibility that there may be some unforeseen costs, so they can be avoided up front. So that's the hospital community certainly has a role for providing information on this. But it's also incumbent on providers themselves, physicians, and insurers to provide as much information as they can. In many cases, though, a lot of states, as you mentioned, this is just a very difficult problem because despite all the efforts that I just talked about, these situations sometimes occur. So even if you do your homework and you're going to go in for a specific surgery and you're sure that your anesthesiologist is in network, the surgeon is, there may be an emergency situation, there may be a delay in a previous surgery, or just through just the press of events or unavoidable circumstances when you do receive services from an out-of-network physician. So those situations are very difficult to deal with. And states have been adopting various legislative solutions. I think there's, over a dozen states have implemented legislation or policies to try to get at that. I can walk through those if you like.
These different plans that the various states are setting forth, are there parallels among them? Do they look somewhat similar, or are they wildly different, Jeff?
I wouldn't say they're wildly different. I think there's essentially 4 categories. And this gets into some detail, but I'll try to make it simple. One is just transparency measures, where the state can require insurance companies to make sure that their provider directories, for example, are up to date, or that providers provide the information to consumers, as much information as they can to make sure this doesn't happen. I think that helps, and that's something that is happening voluntarily, but it may not be the solution. Other solutions could be prohibiting physicians or providers from balance billing altogether. So they bill the insurance company, get paid what they can, and they're unable to obtain the balance that we talked about. As you can imagine, physicians don't like that solution. On the flip side, some states have adopted something called basically establishing a default rate. So in circumstances where it's a true surprise balance bill, that there is a rate established by the government for that situation. And depending on the rate that's set, it may be beneficial to physicians or insurance companies. The problem with the 2 solutions I talked about, the prohibition of balance billing or the default rate, is it's really interfering with the negotiations between a physician and an insurance company. It could potentially increase costs. There's a lot of unintended consequences that make that pretty unattractive to folks. So the 4th option, which seems, if you read policy papers on this topic, seems to be in favor, is a model in Texas and New York, where the state essentially establishes a mediation or arbitration process. So in instances where it truly is a surprise bill, the consumer is taken entirely out of the equation, and the provider and the insurance company are left to try to work it out. And absent an agreement, the case is sent to an arbitrator or a mediator. And I think the goal of this is to set up a process where it encourages providers and insurers to kind of resolve this amicably through negotiations and to take the consumer out of the equation. Again, there's a lot of devil in the details on how the arbitration or mediation is set up and whether it favors one party, providers or physicians, or another, the insurance companies. So you can imagine there's just a lot of issues.
Well,
there.
On behalf of the viewers, can't speak for all of them, but I believe they like choice.
Right.
They want to have low cost.
Right.
They want to be able to take care of their loved ones and themselves. And I think having a legislature, being a former legislator, you say that's not always the way that you want, because it's hard to change those.
Right.
It's hard to change those bills. As new things come along.
Right.
It sounds good, but I think a model like the 1-800, like all the utilities,
right.
they have a great interest in their infrastructure, so they have a number, a one-call number, that maybe the industry should get together, all those parts
right.
that you talked about, and come up with their own one-call number to find out, are these people in line? Am I in the right hospital? Am I looking at the right procedure? What happens if I'm on the table for my leg and all of a sudden I have a heart attack? What happens? And maybe that's the way it should be looked at, because when you throw it to the legislature, you have all these variables that you have the legislature trying to think of. And it'll be good for today, but what's going to happen 3 months from now? And are you going to get the legislature together to amend the law?
Right.
So
these are difficult issues.
So I just ask you, do you agree with those issues, or because you're the policy expert, or do you think they've already been looked at, and that what would you suggest, or what would your association suggest?
I don't think we have a position on this yet. We're exploring all of these issues. We understand it's a complex situation, and certainly we expect that all of this is the beginning of the conversation. There was a hearing held recently by the insurance commissioner, Teresa Miller, where it was an all-day session, essentially.
Here in Harrisburg.
Here in Harrisburg, and provider groups testified, as you can imagine, but a lot of advocates and consumers. And it became pretty clear this is an issue, a serious issue in Pennsylvania, and there's a lot of interest legislatively to deal with this. I think I commented a bit on some of the pros and cons about this. I don't think we have a position. Just one observation, though, is that the prohibition on balance billing solution or the default rate solution, that's a situation where government is getting involved in negotiations and kind of setting a rate. The arbitration mediation model, and this isn't an endorsement, but it's really establishing a process, not mandating a certain payment rate. So it's something that certainly deserves, and it will, I'm certain, get a lot of attention.
Well, Jeff, you talked about a variety of other states. Here in Pennsylvania, could you try to share with our viewers, what are Pennsylvania hospitals doing to deal with this issue?
Well, I talked about it a bit. I think the primary initiative is the guidelines that we talked about. It's something we're promoting, and there was an enormous interest, of course, by hospitals. 70% signed off on these guidelines. And the key focus, at least in regards to this issue, is talking to hospital patients about this topic. To make sure that they're aware that this could potentially occur and take as many steps as possible to avoid it.
One quick question for you.
In the last 15 seconds.
Right, the last 15 seconds is, give us your website number, because you talk about these guidelines, you talk about these other facts. You don't have to say it twice because it'll come up on the screen. But if you could let our viewers know where this is going to be and where they can get in touch with you.
Absolutely. It's, I think, www.haponline.org.
Thanks.
Very good, very good. Well, thank you, Jeff. The time went way too quickly.
Oh, my goodness,
we
yes.
have to have you back to talk about this.
I was surprised because it was...
We're just scratching the surface.
We are.
Well, we want to thank you very much.